Hi, I'm Clay Dixon, and I'm going to tell you about exercise prescription for low back pain clients. Now, low back pain is one of the most prevalent conditions in the United States and the world today, with 84% of the population for adults will be affected by it at some point in their lives. 23% of those will have chronic low back pain, and 11% of those will be disabled by that disease or condition. This will affect their activities of daily living, as well as having psychological and emotional effects. So it is also associated with over $100 billion of lost productivity and lost income at work. So some of the mechanisms for this injury, it could be impingements of the nerve root, strain on the muscles, degeneration of the bones or intervertebral discs. It could be referred pain due to organs in the abdominal cavity. So it's a wide range of reasons for this condition. It is not only limited to professions that have lots of lifting or physical exertion, but it could also be from just sitting at your desk all day. And that would just be improper posture or improper lifting technique for when you're working in, say, like a factory. Um, Low back pain can be classified into three different groups. This is associated with some sort of pathology like cancer or fractures, specific neurological conditions like spinal stenosis, or it could be non-specific low back pain, which accounts for over 90% of the cases. These can be subgrouped into three different phases: the acute phase, which is 4 to 6 weeks, the subacute, which is less than 3 months, and the chronic, which is over 3 months of symptoms. Um, this could be treated with exercise, medications, and therapeutic modalities such as NSAIDs, which are commonly prescribed, as well as stretching in the low back, and then slowly adding in progression of exercises like strengthening for the low back or lower limbs. So, testing considerations. This is may vary just depending on like what type of condition we're treating for. So if it's acute, you would want to rest for a few days, then slowly build back up to regular physical activity. However, if it was a chronic condition, then you would just have to start there and then just slowly work with them. And again, these low back pain may affect cardiorespiratory fitness because of they'll be waiting around, they'll be really deconditioned, but they can follow the general guidelines for the general population. Most accurate testing for cardiorespiratory fitness would be treadmill testing for VO2, and that's ahead of cycle and upper body ergometers. The limitation for treadmill testing, however, would be just anticipated or actual pain due to low back pain. Muscular strength endurance will be diminished due to low back pain also, but they can follow the same considerations. Just the reliability of the test may be affected by the anticipated or fear of re-injury. Flexibility testing considerations, they can follow the same guidelines as the general population. Testing of the low back, hips, legs are associated with back pain, so keep that in mind for or for flexibility testing. Common tests for low back pain improvements are sit to stand, or the 50-foot walk test, or the 6-minute walk test. These are all commonly used to see improvements in exercise testing. So exercise programming, you'd see the biggest limiter would just be modifying exercises that would aggravate low back pain. So staying physically active and avoiding bed rest is one of the most important things for improving symptoms. The only time you want to do bed rest is if you are in the acute phase and you like strain your back from lifting something, for example, and you'd want to rest that for a couple days and then slowly go back into exercising. The minimum amount of exercise volume or intensity may be needed for chronic low back pain patients or clients. Recommendations for aerobic training, they'll follow the general population guidelines as closely as possible, just as long as you don't cause more problems. Make sure that you keep in mind that their back will hurt possibly when they're going downhill or on a treadmill, for example. But they can do 3 to 5 days a week of moderate to vigorous activity. Chronic low back pain may do a little bit less. intensity or they're extremely deconditioned, they can do light activity. Vigorous activity, as long as it does not cause more problems, exacerbate the symptoms. 30 to 60 minutes of physical activity per session. Common types of exercises would be walking, light jogging, perhaps swimming, cycling, and the elliptical. Is they just want to try and progress that volume slowly, like a normal fit VP progression. So resistance exercise training, the main concern would be modifying exercises to prevent unnecessary back pain. Exercises should strengthen core muscles and stabilize the spine. Most studies say that that is one of the best things to go for. You want to work on exercise endurance and just slowly strengthen that. Progression can be done with just resistance bands, increasing sets or repetitions, and then progressing to, say, dumbbells as opposed to body weights or resistance bands. So for flexibility exercise, you can improve that by focusing on the low back, the hips. You can work on the upper legs as well, or the upper body. Flexibility is great. You can do it anytime, any day of the week. When you wake up, when you are going to bed, as many days as you want. 2 to 3 days is recommended though. Tightness or discomfort is when you're stretching to get that that's what you aim for static stretching. You can do 10 to 30 seconds of static stretching. You can follow the same general guidelines as the general population for this. Progression should not exceed unnecessary amount of pain in the low back for the client. So the biggest concern for special considerations for this population is to not cause more problems than they may already be experiencing. So just be ready for them. They may have a bad day. Their backs may just be flaring up, so you just be wary of what symptoms they have. For example, they may have some exercises may cause peripheralization, which is pain that spreads to distal limbs. So you want to avoid exercises like that. Instead, you'd hope for centralization, which is exercises that reduces pains, and it's more of a centralized location as opposed to spreading out. Stretches that focus on the hips or the lower limbs or the back are good for improving symptoms. You just want to manage pain. Don't push them too hard, and just slowly progress and be ready for some setbacks, because they could very well happen. If they do have multiple chronic conditions, just you want to get a physician's approval before doing anything else. So again, that was for low back pain. Thank you for listening.